Question: A 55-year-old male presents with acute chest pain radiating to his left arm, diaphoresis, and shortness of breath. His past medical history includes hypertension, hyperlipidemia, and smoking. On physical examination, he appears distressed, and his blood pressure is 180/110 mmHg. An electrocardiogram, ECG, shows ST segment elevation in the anterior precordial leads, V1, V4. What is the most appropriate immediate intervention for this patient? A. Administration of aspirin and nitroglycerin. B. Immediate coronary artery bypass grafting, CABG. C. Emergent percutaneous coronary intervention, PCI. D. Intravenous heparin and beta blockers. Correct answer C. Emergent percutaneous coronary intervention, PCI. This patient's presentation is highly suggestive of an acute myocardial infarction, AMI, or heart attack, specifically an ST segment elevation myocardial infarction, STEMI. Here's the rationale for choosing PCI as the immediate intervention. Clinical presentation: the patient has classic symptoms of an AMI, including acute chest pain radiating to the left arm, diaphoresis, excessive sweating, and shortness of breath. This constellation of symptoms is highly concerning for a cardiac event. ECG findings: the electrocardiogram, ECG, shows ST segment elevation in the anterior precordial leads, V1, V4. This is a hallmark sign of a STEMI and indicates that there is an acute blockage of a coronary artery supplying the anterior portion of the heart. Risk factors: the patient has several cardiovascular risk factors, including hypertension, hyperlipidemia, and smoking, which increase the likelihood of coronary artery disease, CAD, and AMI. Given these factors, the most appropriate immediate intervention is emergent percutaneous coronary intervention, PCI, also known as angioplasty. PCI involves the insertion of a catheter into the blocked coronary artery to open it up and restore blood flow. This procedure is time-sensitive, and the goal is to restore blood flow as quickly as possible to minimize cardiac muscle damage and improve outcomes. The other options have their roles in the treatment of AMI but are not the immediate first-line intervention. Administration of aspirin and nitroglycerin, option A. These medications are important for relieving symptoms and reducing platelet aggregation but are not the primary intervention for a STEMI. Immediate coronary artery bypass grafting, CABG, option B. CABG is a surgical procedure that is not typically performed emergently in the acute phase of a STEMI. It may be considered later for long-term management. Intravenous heparin and beta blockers, option D. These medications are often used in the management of AMI but are not the immediate first-line intervention. PCI or thrombolytic therapy, if PCI is unavailable, takes precedence in the acute phase. In summary, for a patient with a suspected STEMI, immediate reperfusion therapy with emergent PCI is the gold standard for restoring coronary blood flow and improving outcomes. Time is critical in these cases, so the patient should be transferred to a facility capable of performing PCI as quickly as possible.